So good morning. It's great to be here at Moderna's Norwood facility. The first time the Lieutenant Governor and I became familiar with this site was actually several years ago when Mass Life Science Center issued a series of awards to biotech manufacturers here in the Commonwealth, one of which was the nascent development that was going on this site and in that Polaroid building. And who knew at that time that this particular site would become the epicenter of the most significant and important battle waged against a global pandemic here in the United States. Now more than ever, we are enormously proud to be able to call Moderna a Massachusetts-based company. In addition to this facility that they have here in Norwood and the expansion that's going to take place here, they also have an operation in Cambridge. And there are many, many people who live and work here in the Commonwealth of Mass who have been part of this enormous success. Goes without saying, we are all so grateful for the innovation that happens here at Moderna. And the fact that on a very complicated and difficult task with very short time frames, this company delivered, not just for the people of the Commonwealth, but for people all over the world, in just a matter of months. And I said earlier when we were inside that the first time I heard Moderna mentioned in the context of the COVID pandemic was in March of 2020, and I know exactly where I was. It was nighttime, I was in an automobile, and I was right around Suffolk Downs, and I was talking to a former federal official who did a lot of work in biotech and research, who said to me, you know, there's a company in Massachusetts, Moderna, which I was familiar with, that's working on this mRNA platform, and you know, who knows what will happen, but they could be one of the first companies to actually deliver a vaccine. And you didn't just deliver one, you folks delivered millions and ultimately what will be billions of vaccines that will serve people all over the globe as this battle against the pandemic continues. And before I talk a little more about Moderna and about our vaccine efforts, I do want to give a quick update on COVID. Yesterday, the Department of Public Health reported 472 new COVID-19 cases out of about 42,000 tests. We're now over 22 million tests administered here in the Commonwealth of Massachusetts, and we remain a national leader when it comes to COVID-19 testing. And even as more and more people have gotten vaccinated, testing remains a critical surveillance tool to keep the virus in check as we go forward, and we thank people for continuing to get tested. Our Stop the Spread free testing program currently provides over 35 different locations across the Commonwealth, most of which are targeted to communities where we have seen significant COVID in the past, and they are open and available to everyone. Stop the Spread's been a crucial part of the Commonwealth's testing success. More than 2.3 million tests have been conducted as part of that program alone. We're pleased to announce today that we'll continue to extend the Stop the Spread program through the end of September because it remains an important tool in the battle against COVID. With respect to the rest of the public health statistics, the 7-day average of positivity on our COVID tests is now at 1.32%. That's obviously down to a percentage that's pretty familiar with what we saw back in the early part of last fall. 441 people are in the hospital with COVID and 117 are in the ICU. We also crossed a big milestone yesterday. 3 million people in Massachusetts are now fully vaccinated. That's another big step in our efforts to get vaccines into as large a portion of our population as we possibly can so that we can get back to normal. We're enormously grateful to everybody who's been part of this process, to the healthcare workers, the vaccine providers, and the other partners who have worked so hard for the past several months to make this milestone possible. We remain one of the top performers in the country when it comes to administer vaccines, with nearly 74% of adults having received at least one dose, and we're one of only 5 states in the country that has crossed that 70% milestone. This week, we're distributing more vaccines to providers across Massachusetts. We've been allocated by the Fed program about 245,000 first and second doses. About 82,000 doses are being allocated to hospitals and healthcare providers. About 57,000 doses are going to regional collaboratives. Mass vaccination locations are receiving over 97,000 doses. And in addition to the state allocations, the federal government's allocating over 112,000 doses directly to its retail pharmacy program, which I think, as most people know, we're about 50 pharmacies in Massachusetts in February, and there's now, I think, over 800. 863. We're also getting ready to begin vaccinating 12 to 15-year-olds. On Monday, the FDA authorized the use of Pfizer vaccine for this age group, and today the Advisory Committee on Immunization Practices will meet and make a recommendation on this approval. This group represents about 400,000 individuals here in the Commonwealth, and we're working with our providers and our mass vaccination sites and others to put plans in place to vaccinate this group once we receive word of a final approval. The Department of Public Health has already reached out to the primary care community and to the pediatric provider community in order to discuss with them a process for ensuring that they're part of administering the Pfizer vaccine throughout their practices once the vaccine is approved for this age group. And if parents have questions about the vaccines for their kids, they should contact their primary care provider or their kid's pediatrician for more information. Pending the CDC's approval for this group, people aged 12 to 15 will be able to book appointments or access a walk-up appointment beginning on Thursday, May 13th. We're also pleased that Moderna is moving forward with federal officials on the approval of their vaccine for people under the age of 18. We applaud their progress and look forward to Moderna's vaccine working their way through this important and rigorous approval process as well. More is the better here. We remain a national leader with respect to vaccine distribution. We're on track to hit our goal of vaccinating over 4 million people by early June. And now that we've made so much progress by having almost 75% of our population, adult population, with one dose, we're pivoting our operations to continue to expand the ground game and break down barriers in every zip code. We have a lot of work to do to reach more people, especially in some of our hardest hit communities. And as part of this operation, I'm pleased to announce that our administration will soon launch an employer vaccination program. This program will provide options for the Commonwealth's employers to book appointment blocks for their employees at the state's 7 mass vaccination sites or to request mobile vaccine clinics to arrive on site at their location at a scheduled time. The program is intended to provide 2 great options for employers of all sizes, and it is another way we're working to build out vaccine administration to get more people dosed safely and conveniently. The vaccine is free to everyone, and it remains the best way for folks to protect themselves, their loved ones, their neighbors, and their co-workers. More details will be provided on this program very soon, so stay tuned. And as we create more ways to access vaccine, it's always worth remembering the incredible progress that has been made in such an amazingly short period of time. A year ago, we were preparing to launch phase 1 of our reopening plan, taking cautious first steps toward reopening our economy with very strict protocols in place. Our healthcare system was under tremendous pressure, and here we are, just a year later, and things look very different. Much of our economy has reopened. Our students are returning to their classrooms. Cases and hospitalizations are dropping, and all of the public health metrics continue to move in the right direction. This progress has been made possible thanks to the incredible speed at which scientists developed a life-saving vaccine and the partnership so many have had with organizations like Moderna and so many of the healthcare folks who've been working to get people vaccinated through our program of vaccination sites. Scores of researchers and employees here at Moderna worked around the clock, literally around the clock, many of them sleeping here day after day after day, to complete their work to prove that this vaccine was safe and effective. They relied on existing research and innovation with respect to the mRNA vaccine technology, and they were prepared to work with the federal government on a speedy approval process. This enabled them to achieve their goal in an absolutely record period of time. They were there at the very beginning as we started to vaccinate our healthcare workers in December, and they've played a vital role in our vaccine infrastructure with over 2.8 million doses administered, or 41% of all doses administered here in the Commonwealth. And the vaccine, by the way, my wife was actually a Moderna recipient, and it's been proven to be highly effective at saving lives, keeping people out of the hospital, and reducing the spread of COVID. I just want to say finally, on behalf of all of us, we're very proud that Moderna calls Massachusetts home, and so many of the people who are part of this team are also from Massachusetts. And most importantly of all, Moderna is going to continue to expand their footprint here in Norwood as they continue to grow their vaccine footprint so that they can continue to manufacture and distribute the vaccines that are so critical to getting us out, not just here in Massachusetts, but across the country and around the world from under the grip of this awful and terrible and brutal pandemic. Thanks very much, and with that, I'm going to turn it over to Stephane.
Thank you, Governor Baker. It is an honor to welcome you, your team, and all of our guests today here in Norwood. We are very proud to be a Massachusetts company since our founding in 2011. We opened our Norwood facility in 2018. The facility has been an integral part of our strategy to fight the COVID pandemic. I would like to thank Tony and the town of Norwood for being great partners from the very beginning. Massachusetts continues to be a global leader in the biotech industry. Having our manufacturing facility here in Massachusetts has always been incredibly important for you. It's enabled close collaboration between our research and development team in Cambridge to this manufacturing and technical development team here in Norwood. It allowed us to work with our partners in the state to leverage the incredible innovation of the state, and we'd like to thank you for your support over the years. We are proud to have created a new biotech and manufacturing jobs here in Norwood to make the mRNA vaccine. Last year, in the last 12 months, we created around 650 jobs in Norwood. And we continue to grow the company. We have around double the company size in the last 12 months. And we're not done yet. You can look at the job posting. We are hiring. I want to thank the Moderna team, particularly those that are based here in Norwood, who have been working around the clock, 7 days a week, to manufacture the Moderna COVID-19 vaccine. The team is working hard to ensure high-quality products and to ensure we make as many doses as we can. We know that every dose can save another life. Our employees' commitment to our mission has been exemplary. People have sacrificed vacations, weekends, birthdays, evenings with families, and much more. We all owe them a lot. Because of this commitment and this performance, we announced last week an investment and expansion of our facility in Norwood. We are more than doubling the space of this facility to make it a truly industrial technology center with 3 buildings. This expansion will support 50% increase in production of our COVID-19 vaccine in the United States, with a ramp in the end of the year and early 22. Last week, we raised our goal to make at least 800 million doses in 2021, and the team is still working really hard to get to 1 billion doses. We're investing right now in Massachusetts so that we can get to up to 3 billion doses in 2022. We're also working hard to remain ahead of the virus. We're exploring a strategy to address variants of concern with an updated variant booster vaccine single dose. We shared last week some positive initial clinical data showing that 2 of our booster strategies are very encouraging. We are waiting for the 3rd one in the weeks to come, and then we'll work with the FDA to get a safe and effective variant-specific booster to the American people as fast as we can. As we grow, it is very important for us to build this plant with respecting the environment. This is very important to the company. We want to be here for a long time, and we need to respect the environment. Thank you again, Governor Baker, and all of your team and guests for being here today and supporting Moderna's mission. It is heartwarming to see Massachusetts as the 2nd most vaccinated state in the country. Congratulations for all your hard work and to all the healthcare workers in the state. I would like also to thank you for your leadership and the leadership of your team over the last 14 months. We know how hard those have been, but thanks to you, we have navigated as a state the pandemic and you've kept us safe. It gives us a lot of joy to see that yesterday there was no death in the state of Massachusetts. Thank you so much, everybody. I hand back to you, Karyn.
You guys have questions for Stephane? Start there.
Yeah, do you mind talking about the booster, how that would work? And then obviously we have 3 companies. Is there a plan to get people the booster and they have the same company?
Yes, so we indeed are testing the booster in the clinic after the Moderna Prime series that were injected last year in the phase 3 participants. But our goal is working with the NIH and others to test the mixing of the vaccines, meaning regardless of what vaccine you got initially in early 2021, that when it's time for you to get a booster, you can mix the products.
Do you have the amount of time you need it?
So we're still looking at the clinical data because unfortunately it's a new virus and the vaccines are still new, so we are studying this very carefully with the regulators. But we think it's not impossible that maybe in the fall for people that were vaccinated very early last December, last January, especially for people at high risk, that it might be necessary, especially with the emergence of variants of concern. So we're working with state officials to make sure we are ready at the right time.
Stephane, could you give us an update on the phase 3 studies on children for the Moderna vaccine? We know Pfizer is maybe a week or 2 ahead, but how are you coming?
Yes, so we shared last Wednesday news that the Moderna vaccine in the 12 to 17 years of age has a 96% efficacy. The safety profile is like what we saw for the adults. And we're working with the FDA to get the vaccine authorized as soon as we can. We're also running a study in the 6 months to 11 years of age. That study is going to take a few more months because we have to go very slow down in age to ensure the safety of the children. And we're also starting at a lower dose because given their lower weight, we might need a lower dose for the children. But for the teens, it's going to be the exact same dose, which will help the distribution of the vaccine than the one used in the adults right now.
Do you think it's important to vaccinate children? How important is it to stop the pandemic?
So if you think about herd immunity that many of you have heard of in the last months and quarters, we think it's important, as we know, the children, because of a strong immune system, a lot of time don't get disease, but they can transmit the virus. With the spread of variants of concern, I think it's important to really vaccinate as many people as we can, but I leave it to the state officials to dictate the right policy for the state.
Could you just clarify the booster issue? How many boosters are you working on, and when might they be ready for use?
So we're looking at 3 booster strategy. The current vaccine given as a boost. We're also looking at a vaccine that we developed that is specific against the variant first identified in South Africa. It's 100% of a copy of a spike protein information that we dropped in exactly the same product as the vaccine that many of you have received. And we have data on those 2. What we show is against the variant of concern, both vaccine looks good, but the vaccine designed with a specific South Africa strain looks stronger. And we anticipate it could be a longer duration in terms of efficacy. The third vaccine strategy, which is a mix of 50-50 mass ratio in the same dose of existing vaccine, and the one designed against the strain of South Africa, we should get the data in the next few weeks. When we have that data in the clinic, we will pick which one we'll take for authorization. We'll run a bigger study. The FDA, as I said, very clear, very helpful guidelines, and we're hoping that toward the end of the summer or early fall, we should be able, if the data is good, to have an authorization for a boost to be used in the fall to protect all of us so that we can have a good fall and the next good winter.
Can you just clarify something with the 12 to 17-year-olds? We're hearing a lot about Pfizer today, the 12 to 15-year-olds. When do you anticipate some movement with the FDA on your vaccine for that age?
So we're talking weeks. We're not talking months away. We're talking weeks away. As we know, the safety of those products is critically important. And so we are working with the regulators. The FDA has been amazing over the last 18 months with some time daily discussions and exchange. So safety is priority number 1. And when the FDA will feel comfortable, we'll get the vaccine authorized.
How about in terms of the facility here? Well, how much expansion will you be doing? You said 3 buildings. Do you have, how many buildings do you have now? How much square footage are you going to be adding, et cetera?
So we initially had around 250,000 square feet in this building. And with the new buildings, we're going to get 650,000 square feet, so it's almost tripling the capacity. And in terms of the output, our plan is to is to increase by 50% the output coming out of the Norwood facility to supply the world.
When do you expect to have the facility expanded here?
So we already started. So the governor and the team visited a new wing of the building this morning, but it's going to happen during this year. Our goal is during this year to have more and more capacity coming online, hopefully by the end of the year to be able to be at full capacity.
Doctor, can you just talk a little bit about the 12 to 15-year-olds, provided there is that group that you're anticipating today? We're seeing some school districts saying we're going to make sure students get vaccinated, we're going to mandate it. Still no plans for a statewide mandate on that? Can you talk about that?
Well, first of all, it's day one of 12 to 15, and what we're really focused on at this point is making sure that the information we get out to the pediatric community and the primary care community, as well as to many of the folks who are part of our vaccination network, is there and available for them to support people signing up. There are a bunch of 12 to 15-year-olds who've already pre-registered. I'm sure a lot of folks are going to reach out to their pediatricians and to their healthcare providers. Some folks may even go back to the places where they got their first vaccine for them as an adult and find out if there's Pfizer available for them, for their kids. I think issues associated with sort of the fall, what we really want to do is make sure we get as many people who are eligible to get vaccinated and get them vaccinated in a way that's convenient and accessible to everybody. And I would just point out once again, they're deemed already through proven demonstrable data to be enormously effective, and they're free. And we're going to do everything we can to make sure that there are plenty of places available for people to get them.
So no mandate, no plans for mandate?
No.
How about in terms of clarify, so tomorrow people will be able to sign their kids up on the website starting tomorrow Thursday?
Well, there's some folks who've already pre-registered, but certainly, I mean, people can pre-register today, they can pre-register tomorrow. I would expect some folks are going to hear from their healthcare provider on this. I fully expect that the regional collaboratives will start putting together programs, probably in some cases with their Board of Health, the folks they currently use for their vaccine program, and probably with some of the schools.
I know you sort of said you're going to wait and see, but do you anticipate what will it be like when these folks do get, the children do get, teenagers do get vaccinated? How do you think it will work? I know you said you're working on it when they get to prove new book, but what's the anticipation of how that will work?
I think honestly the process will look very similar to the one that adults got vaccinated on, because for the most part, most of the network is going to be pretty similar and pretty consistent with what we've used so far. We'll probably be looking for people to sign up for a second dose to get an appointment when they show up for a first dose. I do think you'll see more participation from the primary care community and the pediatric community, because in many cases they have very tight relationships with a lot of the kids we're talking about. But we're also going to continue to put a lot of this product into the networks that we've developed in the 20 most hard-hit communities, and work pretty hard to make sure that we're making it available not just to adults in those communities, but also to kids who fall into those categories as well.
Governor, you talked a little bit about vaccine reluctance. Maybe some older people are wait and see, but a lot of those people are just, no, I don't trust it. So how important is it to get the kids involved and then get toward the herd immunity that we talked with Stephane about?
My view on all of this, and I think there's some practical experience about it at this point, is the more people we get vaccinated, the more opportunities there are for people who might be hesitant or suspicious or skeptical to run into friends and family and coworkers and other people they know, neighbors who've gotten vaccinated for whom it has worked. And I think in many respects, part of our objective here, now that we've got roughly 75% of our adult population vaccinated, and a whole opportunity here to continue to vaccinate younger folks, is to do everything we can to not only create a delivery model that makes it possible for people to access vaccines, but also to make sure that it's going to be very hard for a lot of people not to know someone who's gotten vaccinated and feels pretty good about it.
How do you think this is going to go? 400,000 people is a lot of people. We've seen that happen before, but right now, I mean, you can walk in anywhere and get the shot.
That's a good thing, not a bad thing.
They're making like announcements or little announcements.
Yeah.
So I guess I wonder, do you expect like lines again? Do you expect the system to get a little jammed up?
Look, I think the we do have capacity, right? That's a really good thing at this point in time. And we have supply. And I think from our point of view, we're going to work with our network of vaccinators to do what we need to do to make sure that the process can work for people, whether they pursue, you know, an email or a text message they get from their provider, or they get from the healthcare system they're familiar with, or they get from their pre-registration. The bottom line here is we have a lot of capacity. We have available slots for people. The pharmacy system certainly does. I think you'll see some of the pharmacies work together with some of the regional collaboratives and probably some of the schools as well. I mean, there's going to be a lot going on here, and I think we'll be able to come up with a model here that'll make it possible for everybody who wants to get a shot to get one.
Last question. Governor, on another different topic, there's a letter circulating around the prominent Republicans in the country saying that they're going to form a third party if the GOP does not disavow themselves from the Commonwealth. Have you been approached about this letter, and if so, would you sign it?
I haven't been approached about it, and I've been a Republican since I was 20 years old, and I continue to believe in what I consider to be sort of the core values of the party. I've had my differences, as everybody knows, with plenty of folks in the party over the course of the time that I've been in public life, but I'm a big believer in what the party fundamentally stands for, based on what I believe it stands for.
Governor Cheney did say that she believes the Republican Party is abandoning the rule of law and democratic principles. Do you believe that's true?
I made very clear that I felt the election process that took place back in November was fair, and that President Joe Biden won the election. And on those issues, I believe Liz Cheney is absolutely right.
Can you talk about your experience yesterday, your conversation with the president, how that went? There was obviously a show of bipartisanship from this. Can you share a little bit about, you know, what you took away from that?
Well, first of all, you know, he mentioned during the call, the president mentioned during the call, that governors tend to be a lot less partisan. That's true. I mean, I talk to Republican and Democrat governors on a pretty regular basis, the same way Secretary Sudders talks to secretaries of Health and Human Services in other states, the same way the lieutenant governor talks to her colleagues in other states, because in many cases, we have very common problems we're all trying to solve. And over the course of the past year, there's been a tremendous amount of both scheduled and unscheduled and informal conversations and dialogues between and among governors. I mean, we've had, at one point in time, we were having weekly conversations with staff and elected officials in the Northeast, some of which was structured, scheduled, and some of which was literally pick up the phone and call. And I think in many ways, one of the things I like about playing this role as governor is the fact that most governors will pick up the phone when you call them and help you try to solve whatever problem it is that you're trying to solve, and vice versa, because we have a lot of commonality on that. And I think in some ways it's something I wish there was a lot more of at the federal level.
Can we get an update on the gas line? Any concern? I guess some students trying to get home down south and stuff.
Well, the gas issue, obviously in the South, is enormously problematic. At this point in time, it's not an issue in the Northeast, and that's primarily because a lot of our distribution comes from other sources. But we're paying a lot of attention to it.
Governor, real quick, can I ask you about high school sports? You've watched your share of high school sports.
I couldn't hear you over Aaron, so.
I'll try to speak louder. No one's ever told me to be
Yeah.
quiet. High school sports, Little League sports, kids still have to wear a mask on the pitcher's mound. They're supposed to sanitize baths, and yet restaurants are told they don't have to sanitize the ketchup bottles anymore. It seems like a disconnect. Some parents are writing me about it. Is there any way that that could be loosened up a little?
We're working on it. We're well aware of the issues. We've been following the changes in a lot of the data coming out of the CDC and some of the most recent studies. And we'll have more to say about it soon.
I wanted to ask, some of your Republican cohorts in other states are canceling the extra $300 in unemployment benefits, that's saying people are not going back to work. Here in Massachusetts, unemployment is still more than double what it was pre-pandemic.
Yep.
Business leaders are saying getting people to come back to jobs is a problem. Have you thought about maybe canceling the extra benefits, or is that something you're considering?
Well, Massachusetts, as I think we all know, is a very high-cost state. And the vast majority of the people who were most profoundly impacted by the pandemic and by some of the rules that we put in place were what I would refer to as working people. And what I would really like to do is to continue to see people get vaccinated, continue to see the drops in our public health data that we're looking for, and be able to move forward to aggressively reopen our economy, create the jobs for people, and then let people find their way back to work. But my biggest concern about this issue in a state like Massachusetts is we have very high housing costs. Food prices have gone up. We have high costs generally, and most of the people who've been most profoundly impacted by everything associated with the pandemic are folks who are not, for the most part, even at the median end, much less the upper end of the wage scale. And they have, they have rent to pay, they have utility bills to pay. What I want to do is get them back to work by continuing to reopen the economy and creating jobs and making it possible for them to do that.
Thanks, everyone. Moving it up, August 1st, yeah, any timeline?
We're still following the data, and we will be back to you on that one. I mean, we were very worried because many of the governors that we talked to and a bunch of the Health and Human Service secretaries that Secretary Sudders talked to said their demand for vaccines just stopped. I mean, it just fell off the table. Ours has gotten a little sluggish, but it has not fallen off the table, and I fully expect that a lot of those open slots are going to get picked up by 12 to 15-year-olds, and hopefully some of the outreach work we're doing is going to bring some additional adults into this thing, and we'll continue to get people vaccinated. But for me, and I think for the LG, the fastest way back to reopening is to continue to get people vaccinated, continuing to get continued improvements on the hospital and case count data, and that's really the thing we're paying the most attention to.
Thank you.
Any comments about 0 deaths yesterday?
So what?
Any comments about 0 deaths yesterday?
Well, obviously, any day that the COVID doesn't take a life is worth noting. But the other thing I would say here is, and this is again, evidence of the power and the importance of these vaccines. The death data generally, day after day after day, since the vaccines really started to take hold among that over 65 population, has gone down precipitously to the point where we've had 7-day averages now that have been under 10. We had nothing like that through most of the summer, the spring, the summer, and the fall, and the early part of winter. And a huge part of that is the success that those vaccines have had in protecting people over the age of 65 and folks with comorbidities for whom that COVID was most dangerous. And that's real life experience right here in the Commonwealth. And yet again, another example of why it's so important for people to get vaccinated, because this stuff works.
Thank you.
Thanks.
Thank you, Joe.
And thanks again to Moderna for having us. To all of you. God bless.